Hi, I'm Alison Geddes. I'm a clinical nurse specialist here at Glasgow Private Clinic, and I offer autism assessments for children and adults.
Hi, I'm Kim Barron. I am an advanced nurse practitioner and ADHD nurse specialist. I see adults between the ages of 16 to 65 for ADHD and all other mental health difficulties.
And I think at the Glasgow Private Clinic, we are offering a kind of full service across the age range to provide, I suppose, mental health services for neurodivergent individuals. And it may be that you've been considering autism or ADHD for yourself or your child. And so we ask you to get in touch with us.
So we know that autism and ADHD are super linked, which is great that we get to work together and offer that wraparound service. As an independent prescriber, I can see you from your assessment straight through to your treatment, and we can work together to get you to where you want to be. It might be that you don't feel that you want medication. That's absolutely fine. For some people, they just want assessment. They want to understand. They want to know what's going on for them, and that is absolutely fine as well.
And I suppose there's been an increase in kind of awareness around autism and ADHD. And so at the Glasgow Private Clinic, we recognise the need for providing an increased number of appointments for families and for individuals who are considering or suspect they may be autistic or have ADHD. But I guess people might be wondering, why would they seek a diagnosis at all if they are functioning fairly well, but maybe their mental health hasn't been great over the years? I'm just wondering the kind of people you might see.
I think I see so many different people with different reasons they want to come in.
Yeah.
A lot of people want to understand themselves, which is absolutely, you want us to understand your experience through a kind of lens. So if you think, do you know what, is this why? And when people get the diagnosis, often they can feel a sense of relief. And maybe that's all they need, that's all that they want. Or do they need to look at something else? Do we need to look at depression, anxiety, any of these other things? And it's about getting that support and being able to get your voice heard and feel understood. I think that's the biggest thing I see with people, is that they don't feel understood by other people or even themselves.
Yeah. And I think, I see a lot of people across the age range, but I think middle age, getting to a certain age, having children of your own, and adults are now getting a diagnosis on the back of their own children being diagnosed.
Oh, absolutely. I think people didn't understand before. So now when we're understanding and seeing our children, we go, oh, because there's such a huge genetic component to it as well. And for us women, we have hormonal fluctuations that come at certain points in our life, children, menopause, and that has a real influence in ADHD as well, which is not so well known. It's not your typical hyperactive bad boys and inattentive daydreamy girls. It presents in so many different ways, and that's why our assessments are reasonably long, so we understand what life's like for you, and if that is what's going on for you, and that's how you can understand your life now.
And I think I've been seeing a rise in autistic women who have been missed or misdiagnosed, or have received other diagnosis, but maybe they haven't completely fitted in with possible autism, possible ADHD. And when they receive a diagnosis of autism, it kind of makes everything make sense in some ways. And especially, I suppose, middle-aged women are starting to recognise they did have ADHD, but their heightened symptoms in menopause, perimenopause, are worse, aren't they?
Yeah, as that estrogen drops.
Yep.
And that's something that we definitely look at as well.
Yep.
It's so different for the experience of men and the experience of women too. And I think we're really quite good at treating somebody, not just based on gender, but based on their individual life and what their needs are. Because I don't think there's a typical person.
No, and I think that's what I love about this job, is because everybody that comes in is so different and has got their own story, and this is why we enjoy working in mental health, working with neurodivergent individuals.
But I think the practicalities, I think, is what a lot of people want to know. We both offer initial assessments, because the full assessment, quite rightly so, is a big undertaking. And obviously there's money attached to that as well, but we want to make sure it's right for you. So both Alison and I will offer initial assessments. We both offer initial telephone calls as well. So you can explore it a little bit further. That can be booked online under both of our pages.
Yep. And I suppose I can refer people to you for if I suspect ADHD.
Absolutely.
And vice versa.
Yeah,
we can look at autism if it's in the mix in some of our clients. So we take a holistic approach at Glasgow Private Clinic, and we have other clinicians that make our team more multidisciplinary. We work with psychiatry, we work with psychology, occupational therapists and speech and language therapists to kind of provide a more multidisciplinary service.
For myself as well, if you've had your diagnosis elsewhere, you can absolutely reach out to me and we can have a look at your assessment and see if you do want to continue with your treatment here, because I'm aware not all services offer that complete follow through. So absolutely reach out, ask the question. And I think that's one of the big things that I would like everybody to know. Ask the question. It's pretty nerve-wracking. It's a lot for you to consider, but hopefully you can see from this video we are not even remotely scary.
Well, try not to be. So if you're thinking about an autism ADHD assessment, please get in touch. You can find both Kim and my pages on the website. So get in touch even for an initial call or book in for an initial assessment.
Yeah, look forward to speaking to you.